People, I'm back. I was on vacation with my family, which was amazing, and I do not want to be home right now. But I got home because I need to study. So my family's still at the cottage, and I'm so jealous. I wish I was there. I am doing this loveliness. But as I'm going through everything, first of all, hi. How are you? Nice to finally talk to you again. It's been a few weeks, I know. I was going to do a video on chemo, my chemo series, but I decided that this kind of has something to do with it, so maybe this could be part of my series too. I'll name it Chemo Series dash Adherence to Treatment throughout the cancer process. How's that for nerdy? That's going to be my title because that's what I'm talking about. If you don't know what adherence is, nifty little thing here. According to Haynes in 1979, is the extent that someone's behavior coincides or is in agreement with medical health advice. Interesting. Therefore, if someone is not adhering to medical advice, they are disagreeing. It's brilliant stuff, people. I decided to link this to my situation with cancer because it's full of adherence. Like, okay, so let's just say you're going into the doctor's office and they tell you you have cancer. And then you're kind of shocked by the word cancer, so you're like kind of freaking out a little bit. And you don't know what you're going to do. Basically all you know is that your option is chemo because you hear about that a lot. But there are other options, but they don't normally discuss them with you unless they directly apply to your situation. But instantly when you hear cancer, you think of chemo because that's pretty much the regimen of what they're going to do with you. So that is basically a form of adherence. And you're kind of like, what are my options, doc? And they tell you, and they're like, we're going to put you on chemotherapy for 6 months and then 15 treatments of radiation, give or take. You basically say yes, and that's adhering to medical advice, because it's really scary being a cancer patient because you don't really know your options, and you're not a professional, so hearing the word cancer, you think of life-threatening, because that's what it is, and you're like, I'm going to do anything to prevent myself from getting a further stage of cancer or, becoming more ill than you already are. So the only thing that you know to do is what they tell you. So basically, they tell you to do chemo, you're going to do chemo. They tell you to do radiation, you're going to do radiation. I did chemo for 4 months, and that was all I was going to do, and then either that was it, or I was going to do some radiation after. And then, because the chemo was working, they decided to do 2 more months of chemo. So after all this crap that I went through, and I was like dreading going to chemo again, I had to do 2 more months of it. So I wanted to shoot myself because I hated it, and I didn't want to do it anymore. So it was really hard on me, but I did it, and I did it because they told me to, basically. They told me the facts and they educated me, but it's like, if you said no to it, it would be like the doctors would look at you like you had a third head. A third head? Do we have 2 heads? No. But a third eye? I don't know. Back on track. So there's a lot of reasons why people would not adhere or listen to their doctor, but when you have cancer, there's not a lot of reasons why you wouldn't, other than maybe you can't get to treatment physically. So some people can't get a ride to treatment, so there's actually programs now where people drive people to their treatments so they can actually do something about cancer rather than just sitting there and not being able to do anything. Also, like in the States especially, like if you don't have the money for treatment, you have low social economic status, stuff like that. Like maybe you have 5 kids and you're a single mom or a single dad, and you can't afford like all those drugs. Like it's not just the treatments that you have to worry about. You have to worry about your gas for getting there, even a special diet you might have to go on for like celiac disease, things like that. and some treatments are crazy, like for chronic kidney failure patients, they have to go on a low sodium diet, and you also have to go for what's it called, hemodialysis 3 times a week. So it's just a real big mess up in your schedule, and it's very inconvenient, and it's a total lifestyle change. So for that reason, and also for cancer, chemo patients, you're going to doctors every 3 months after you finish all your treatments. But before that, like when you're going through treatments, you're going there 2 times, well, it depends on your situation, but for me it was once a week to twice a week, depending on what was going on, and like checkups, and if things go wrong, complications, if you're back in the hospital where you don't want to be on your days off from treatment. So just inconveniences like that might make you want to stop, and I was very close to stopping. I wasn't actually, but in my mind, because the chemo affected me so much and I was very, very sick from it, I didn't even want to continue on. So I was thinking, of stopping, but I knew I wouldn't, because that's my only option. Yeah, this is basically helping me study, because this is what my exam is on adherence and reducing non-adherence. So how can you get people to basically listen to medical advice, take the right dosage of prescribed drugs, and continue on with their treatments. So like if you have antibiotics, you're supposed to finish the pills or whatever it is, liquids or whatever, the drug, all the way until it's gone, because that's what your prescribed medication was. But a lot of people, as soon as they start feeling better, they stop taking the meds, and that's not right, because there's still like leftover things in your body that need to be destroyed, and just because you feel better, it doesn't mean it's gone. Like, I just take anybody with cancer, for example. I know I always relate everything back to cancer, but it's really prominent, and it's also obviously why I started this channel, so I'm always going to do that. Some people aren't going to want to finish with chemo because of the adverse side effects of the chemo, and also like the needles that you have to give yourself. And luckily I had my mom to do it, she's a nurse, and like I didn't want to inject myself, but I know people who have had to inject themselves with Neupogen or Neulasta, which makes you feel horrible, to keep your white blood cell counts up in order to do the chemo. So it's like, it sucks all around, because you're putting yourself in pain from these needles, making yourself feel like an old woman, because it gives you like really bad bone aches, and like I didn't want anyone to touch me because my skin hurt from the needle. So I didn't even want to go through the treatments anymore, but in order to do the treatments, I had to go through more crap. It was just great. It was lovely. And one last thing that I wanted to say about adherence, because I'm such a nerd, is that I think that the main thing about like complying with your doctor is that you have a good relationship with your doctor. So that's basically the key, is to communicate with your patients. Please, doctors, communicate and educate your patients so that they're not in the dark when it comes to their treatments and their disease. Because the patients need to know these things in order to make decisions, because ultimately the decision is up to the patient. You don't have to say yes. Sometimes it's good to get a second opinion, because doctors might mess up. Like, they're not perfect, they're humans too. So getting a second opinion is, good. For me, I already had a second opinion. Like, my family doctor got the scan for me. She looked at it. She said it might be cancer, so I needed a biopsy. And then a surgeon looked at it and said I should get a biopsy, so she did it. And then a few different doctors looked at my scans and told me it was cancer. So as soon as they hear the word cancer, they take it really seriously. So basically it happens so fast too. So when you're in there and you just get diagnosed, it's basically like, okay, you're gonna go through all these tests to make sure that you can withstand chemo, and then you're gonna do chemo, and then we'll see from there. So it's very, very quick. My diagnosis and my treatment happened within 2 weeks of each other. So I got diagnosed, and then I did like 10 different 2 scans, like pulmonary functions test, like for my heart, or for my breathing, sorry. The heart test, the echo, so bone marrow biopsy, which was lovely, and that's basically my spiel diddlies. This is affecting me and people I know every day, so adherence is very interesting to me because because I went through it and I didn't even really realize. It was like blind adherence, I like to call it, because it's just like, yep, okay, whatever you say, I'll do it. I'm on the train to getting better, so you'll do anything. Next time you're at the doctor and they tell you to do something, think twice about it, because it's your decision, so you have to be comfortable with your decision and know all the options and know why you choose to say yes or choose to say no. And don't think that saying no is such a bad thing, because it's up to you, and maybe get a second opinion if you're uncomfortable with just saying yes. Or do your research. Go online, Google stuff, and you'll find out the best option. So yeah, thank you for listening to my crazy studying dynamic, because apparently I'm learning this way, which is good. But yeah, so wish me luck. It's my last exam ever, people. Ever. Like, of my whole degree. Like, I'm done after this, so I'm so excited. Yay. If you have any questions, email me or inbox me. Subscribe to my channel, because I have 99 subscribers, and my whole goal of this thing was to get 100 subscribers. One more person that needs to subscribe. Anyways, yeah. Nice talking to you. I feel like it's been forever, but I've been in paradise. Sorry, like, what can I say? It's been so relaxing. Jealous? Yeah, probably. You guys have been like working, going to school, and I've been like, Hey, but I did come back for class, so I was in paradise, and I drove 2 hours to come home. For my class, that's 3 hours, and then drive back. So, yeah, I'm dedicated. I'm a dedicated student. I'm ready to get this done. So yeah, bye.